Okay, our next speaker is Dr. Brent Weiser, class of 1985. He is speaking about ophthalmology, Oscar Wilde, RCSI. He lives in Toronto, having completed his ophthalmology residency at the University of Toronto and a glaucoma fellowship at the University of Edinburgh. He's currently the professor in Queen's University, Kingston, with a community affiliation. Could you welcome, please, Dr. Brent Weiser?
Thanks very much. I'd just like to say that the last talk, my son Evan is a major heart surgery survivor of 30 years. So thank you very much for the work you do. So, okay, so what do ophthalmology, Oscar Wilde, and RCSI all have in common? Sir William Wilde, Oscar's father, a distinguished mid-19th century otologist and ophthalmologist. As I'm an ophthalmologist, and many will tell you, including my fellow classmate ophthalmologists, Salwan, Kate, Rosie, George, and Fred, the eye is the jewel of the human body. So I'll concentrate today on William Wilde's ophthalmology career. Sorry, Camilla Carroll, or to any other otologists here today. So first, a little personal history of how I became interested in these connections. While studying for finals 41 years ago, I think this picture was taken a couple of years before that, I developed an ocular migraine, which looks like this, or like this. Panicking and not knowing what it was, my roommate, the late Gary Silver, you see her on the right, who roomed with Amin Patel and I, brought me down to the Royal Victoria Eye and Ear Hospital. And this is where I had my first exposure to ophthalmology. This led to an interest that developed into a career. Fast forward 40 years, I had the opportunity to see the Toronto premiere of the play De Profundis, during which I was inspired to revisit the life of Oscar Wilde and family. De Profundis is Oscar Wilde's 55,000-word letter that he wrote in his cell in the Reading jail after being convicted of what was then called gross indecency with other men after dropping his case of libel against the Marquess of Queensberry, John Sholto Douglas. For this, he was sentenced to 2 years of hard labor in 1895 to 1897. This is his prison cell as it looks today as a museum piece in the Reading jail. In his lengthy letter, Oscar mentions his parents, Jane Wilde and William Wilde, and compares and contrasts them to the family of the Lord Alfred Douglas, affectionately called Bosie, and the Marquess of Queensberry, Lord Alfred Douglas's father. He wrote, "She and my father had bequeathed me a name they had made noble and honored, not merely in literature, art, archaeology, and science, but in the public history of my own country and its evolution as a nation." Wilde is clearly emphasizing that he had a distinguished name and a high social position, as opposed to the terrible legacy of the Douglas family and the Marquess of Queensberry, a histrionic bully. Oscar certainly merged the talents he had taken from his parents with their sense of nobility and their feeling that they could do whatever they liked. As an aside, ironically, modern-day boxing rules carry the Marquess of Queensberry name, despite having had nothing to do with devising the rules. And here's another connection. These rules were meant to prevent eye injuries like these. So I'd like to mention the Ballad of Reading Jail, or Gaol, Oscar Wilde's last work before his death in 1900. The ballad was inspired by his prison experience and comprised in part by a plea for penal reform. The poem remains relevant today as it addresses universal themes of justice, humanity, and the consequences of our actions. The ballad takes about 30 minutes to recite. Here are a few of the first verses. You can listen to this on YouTube with the version of the ballad recited by poet Arthur Wood, which is terrific. So I'll get back to the intricacies of the legal case between Wilde and Queensberry a little later. So back to Sir William Wilde. He was born in 1815 and in Castlereagh, County Roscommon. He was a dominant figure in otology and ophthalmology in the Great Dublin era of medicine. He was also a distinguished archaeologist and statistician, and cataloger of Irish antiquities. He was steeped in Irish mythology and used his knowledge to develop a close rapport with the Irish peasantry during the potato famine. He was surgeon oculist to Queen Victoria. He was knighted at Dublin Castle in 1864 for his work for medical contributions to the Irish census. This is his tombstone in the Jerome Cemetery and Mount Jerome Cemetery in Harold's Cross. Here you see the tributes on the tombstone with the notable misspelling of the word ophthalmic with the missing H. I still misspell it to this day. This is his home where the family lived on Marion Square. So Sir William married Jane Elgie from Wexford, a famous Irish poet who published under the name of Speranza. They married in 1851. Jane was a well-known Irish young nationalist as well. They had 3 children, including Oscar, born in 1854. So, Sir William also had 3 children out of wedlock prior to meeting Jane Elgie, one of which was Henry Wilson, who was also trained medically as an ophthalmologist and became the professor of ophthalmology at RCSI. So Sir William's early training included an apprenticeship with one of our most famous grads, Abraham Collis. He was taught by Robert Graves and William Stokes after he had enrolled at the Dublin Park Street Medical School and Dr. Stevens Hospital, seen here, which closed in 1987 and is a HSC executive office for the Irish Ministry of Health. The Dublin Park Street Medical School was started by Professor Arthur Jacob, who I'll speak about a little bit later, and Dr. Robert Graves. By all accounts, William Wilde was an exceptional student, submitting a prize-winning paper on spina bifida while on his obstetrics rotation at the Rotunda. He was also trained by James Cusack and Sir Philip Crampton here, 4-time president of RCSI and maybe the most preeminent Irish surgeon of his time. Wilde received his RCSI licentiate degree in 1837. Shortly afterwards, he traveled abroad, chaperoning a wealthy patient of Dr. Graves on a Mediterranean cruise. After leaving the patient, Wilde spent several months in Egypt, which had a defining influence on his life. His interests in botany, zoology, and more significantly, archaeology were stimulated, and he recorded his European and Mediterranean travels in a 2-volume book. His curiosity in ophthalmology was aroused in Egypt after encountering the effects of trachoma, a chlamydial bacterial eye infection that looks like this. On his return, he went to London to spend 6 months at the famed Moorfields Eye Hospital. He was eventually introduced to a William Farr, an epidemiologist and a founder of medical statistics. One of his significant medical contributions, which he elaborated on in his publication called Practical Observations on Oral Surgery, was the introduction of meticulous documentation involving the demographics, treatment of patients, and most importantly, outcomes. His work led to what is known today as evidence-based medicine. He was an early adapter of chloroform anesthesia and the use of atropine eye drops in the management of inflammatory diseases of the eye. During the potato famine in 1850, while working on the Irish census, he championed the empirical use of cod liver oil, a dietary supplement rich in vitamin A and D, in the management of xerophthalmia, a condition characterized by progressive dryness of the eye that often led to blindness, which during the potato famine was caused by vitamin A deficiency. And this is xerophthalmia. There were over 10,000 cases of blindness during the famine caused by this. So Sir William founded St. Mark's Ophthalmic Hospital for the diseases of the eye and ear in 1844, and it was a hospital largely for the poor. The hospital became so successful that in 1850, he purchased the recently vacated Park Street Medical School and transferred St. Mark's to that site. This hospital became the primary eye infirmary and one of the only hospitals in the British Isles specializing in diseases of the ear. St. Mark's eventually led to the formation of the Royal Victoria Eye and Ear Hospital. To this day, the Royal Eye and Ear is a national referral center for eyes and ear, nose, and throat. It was established in 1895 by amalgamating the National Eye Hospital and St. Mark's Hospital. So, Sir William's illegitimate son, Henry Wilson, also an ophthalmologist, succeeded Wilson as the chief at St. Mark's. Henry Wilson's lectures on the theory and practice of the ophthalmoscope in 1868 is considered to be the first text in English on the subject. It is dedicated to Sir William by his affectionate pupil, no pun intended. Henry Wilson was succeeded by Henry Swansea, who spearheaded the amalgamation of the two Dublin Iron-era hospitals. His daughter, Mary Swansea, was a famous Irish artist whose works have hung in the National Gallery of Art and Modern Art Gallery. Her grandfather, John Denham, was president of RCSI from 1873 to 1874. So back to Sir William. In 1854, just before the birth of Oscar, he treated a patient named Mary Travers, age 19, and he waived his fee for his consultation and treatment of her because he knew her father, a Trinity College medical prof. Once her treatments had ended, she continued to see Sir William and became close to both William and Jane Wilde. He continued an unprofessional relationship with her, and when he tired of her years later, Mary Travers was determined to ruin Wilde and circulated leaflets suggesting he had raped her while under the influence of chloroform. Jane Wilde was incensed by these accusations and wrote to Mary Travers' father, protesting the accusations. Mary Travers, after reading the letter, started proceedings to sue Jane Wilde for libel, thereby implicating Sir William. The court ruled in favor of Mary Travers, but awarded damages of 1 farthing, a British coin worth a quarter of a penny. William was left with legal fees of £2,000, the equivalent of 250,000 euros today. So Sir William and Oscar could have learned from Oscar's quote, "I can resist everything except temptation." So it's remarkable the number of connections there are between the case of Mary Travers versus William Wilde and the case of the Marquis of Queensberry versus Oscar Wilde. There was a frenetic, fearless, almost manic activity of both Mary Travers and Queensberry, who sought to embarrass and harass in public and in private William and Oscar, both of whom were becoming increasingly famous and feeling more unassailable. The image of Mary Travers outside a lecture William was to give was similar to the Marquis of Queensberry trying to disrupt the opening night of The Importance of Being Earnest in 1895, which played here at the St. James Theatre. And here's a scene from the play on opening night. The Marquis of Queensberry also left printed accusations for everyone to read. The famous business card known then as a calling card, but the famous phrasing posing as a sodomite at a club frequently attended by Oscar. Queensberry misspelled sodomite as sodomite. This card led to Oscar suing the Marquis of Queensberry for libel, and he was encouraged to do so by his lover, Lord Alfred. Both controversies centered on a long and turbulent and probable sexual relationship between one of the Wildes and a younger person. Despite the similarities, the outcomes were different. Oscar went to prison and was ostracized by polite society, while many in the medical establishment supported Sir William, and in the long run, his and Jane Wilde's lives outwardly were not affected, but his clinical practice began to suffer because of the trial. And around this time, he began to lose his enthusiasm for surgery, so the Wilde family left Dublin for Mortura near the village of Cong in County Mayo, where he wrote Loch Corrib, Its Shores and Islands, one of his most engaging books in 1866. So I'd be remiss to not mention the other prominent ophthalmologist of that era, Professor Arthur Jacob. Jacobs was professor of anatomy and physiology at RCSI for 41 years. Unfortunately, there was a personal animosity between Jacobs and Wilde, and some refer to it as the ophthalmic tragedy of its time. As Professor Arthur Jacob became an ocular pathologist, he was known for his depiction and description of cataract surgery without anesthesia, and he also described Jacob's ulcer, also known as a rodent ulcer or as a basal cell carcinoma of the lid. He coined the term Jacob's membrane, otherwise known as the neurosensory retina, or rods and cones layer of the eye. This is a picture of the retina as taken by an OCT, an optical coherence tomography machine, a common modern day and indispensable ophthalmology diagnostic tool, which depicts the retina and neurosensory retina, which Jacobs first described. The next slide depicts the neurosensory retina, described by Jacobs, detaching from the RPE layer of the retina. So before I conclude, I'd like to pay tribute to Dr. Ronan Kelly, college historian who named his recent book on the history of RCSI in Arthur Jacobs' honor, Every Branch of the Healing Art. It's a beautiful book on the history of RCSI, Ronan was very generous in helping me with this talk. So in conclusion, after having drawn the parallels and interesting connections between Oscar Wilde, his father, ophthalmology, and RCSI, it is clear that there's still so much more to explore. As Oscar Wilde said, the truth is rarely pure and never simple. I hope this has sparked your curiosity. It certainly has mine. Thank you.